Sadie Kealebale. I am employed at Kwenaetlhapile Sadie Hospital, a public hospital in MAHE, Botswana. I was offered a postgraduate diploma in sexual and reproductive medicine, as well as a Master's of Science in Sexual and Reproductive Medicine by Merck Foundation. I completed my Master's of Science in March 2023. The course content of the two courses are offered to me, mostly focusing on sexual and reproductive health issues. My Master's of Science course was more on research project in sexual and reproductive medicine. The mode of learning we learn through is an online-based learning where we use the learner module to interact with our tutors. I'm overall happy with how the courses have been provided. The one thing I'm happy about the courses is that the University of South Wales provides a vast library where we can do researches. There's a lot of information there, a lot of literature there. It provides us with a simple way of getting this research projects that we need. Also, the tutors provided, they guide us on how to go through our projects. They essentially give us a step-by-step on how to go about our projects. They are professional, they are responsive, they push us to do the best that we can do. So overall, I am happy with how I've gone through my courses. As a doctor in Kwenaetlhapile Hospital, I do provide cervical cancer programming to women. Since going through this course, I've had the opportunity to incorporate fertility care to the women I see. These women mostly come to my clinic for cervical cancer screening, but often have issues pertaining to fertility. So I'm able to do a thorough history, do basic examination, do basic investigation, and start basic treatment. And that way, patients are able to be investigated early on as they await for a specialist review. Bear in mind that getting a specialist appointment in our setting goes anywhere from 3 to 6 to 12 months. So being able to start that process going for them, it reduces the time they have to wait to be seen and to start treatment. That's one of the greatest things I've been able to start. In terms of teaching, Kwenaetlhapile is a teaching hospital. We do have medical students coming in. Part of the teaching is to do audits, which requires them to do researches to reference. So as somebody who has gone through the Merck Foundation programs, I am able to guide them in literature review and using the Harvard reference method. So these are some of the things I've been able to do since doing my courses. As a young doctor who aspires to specialize in obstetrics and gynecology, having been able to go through the Merck Foundation program, learn how to do a research project, I see this as an advantage to me in that when I go into my specialization, I would need to do an independent research project. So I am in a better position to be able to go into the program I want to do. The other benefit is that ever since being able to see patients with fertility issues and do basic investigation and basic treatment for them, it reduces the burden, the time they have to take to go and see the specialist. For some patients, when we do start basic treatment, they get successful. And for those who have to wait, they have majority of the investigations being done before they see the specialist. Another advantage of having doing this career is the vast knowledge that I've got to acquire as I went through my studies. As a doctor, I work mostly in a female department, obs and gynae, but the Merck Foundation program has given me an opportunity to learn about male fertility and sexual reproductive diseases. So all in all, I have vast knowledge not only on the females but also on the male side. This has improved my care on how I see patients and the general public. In terms of improving the overall healthcare system in my country, One, we are able to do investigations early. We are able to treat patients early. I'm able to refer patients to where they're supposed to be. If I see male patients who need to see a male specialist, I'm able to make that referral, and I'm able to refer our female patients through the gynecologist in a timely manner. So that is an improvement on how we've been seeing our patients. I actually do refer this course to all my doctor friends, especially doctors like me who work in rural areas. One, it improves your knowledge. Medicine is all about learning. Literature changes every minute, so you get to be up to date with the current literature. It keeps you going, you don't get left behind. So I would refer and I encourage all my doctor friends to enroll in this program. I am very grateful to Merck Foundation for having given me this opportunity to go through not only one but two courses. As I say, this has put me in a better position to apply for that course that I've always wanted to do, has improved my patient care drastically. So thank you, Merck Foundation.